Hi everybody, this is Joe Gregory. This is my presentation on my research proposal, reducing symptoms of generalized anxiety disorder, or GAD, in individuals exposed to childhood trauma. So firstly, childhood trauma can be a strong predictor of GAD. And while GAD is complex, there can be many different causes or things that contribute to a cause. There's no determined or definitive cause of generalized anxiety disorder that has been discovered. Now, the goal of my study would be to find and identify the most effective treatment method for individuals who have suffered childhood trauma and been diagnosed with generalized anxiety disorder. Because childhood trauma can also be quite complex and may require different methods of treatment. So what we know already is that there's a correlation between generalized anxiety disorder and development of anxiety, or excuse me, correlation between childhood trauma and the development of anxiety disorders. And there was a study done in 2022 about the cause of anxiety disorders. And one principal finding in the study is that adverse childhood experiences, or ACEs, were indirectly predictors of development of GAD. They did this through contrast avoidance of worry, which is just excessive worry to avoid the contrast between negative and positive emotions, and interpersonal problems, which is being like cold and distant socially. So they found that ACEs tend to lead to the contrast avoidance of worry and interpersonal problems, which then contributed to the development of generalized anxiety disorder. So real quick, one common treatment for anxiety and commonly used in the treatment of GAD is called CBT, or cognitive behavioral therapy, and has been proven time and time again to be effective in reducing anxiety and depression symptoms. In 2024, this was reconfirmed by Basel and Associates in a study to test the effectiveness of what they call VCBT, or video administered cognitive behavioral therapy. This is therapy sessions that were done via Zoom meeting, and it was found to be just as effective as in-person CBT. And in 2021, there was an extensive literature review done on trauma-specific treatments in patients with PTSD. One of these trauma-specific treatments in particular is called accelerated resolution therapy, and was found to be effective in reducing symptoms of anxiety and depression in individuals who had experienced trauma. ART uses eye movement to help individuals process the trauma that they've experienced. So my hypothesis for this study is that there will be a difference in the effectiveness of anxiety symptom reduction between ART and CBT. And I predict that ART will be more effective in reducing GAD symptoms than CBT. I included a list here of appealing aspects of ART, a couple principal aspects, as it typically only takes 3 to 4 sessions to see a difference, which is quite fast compared to other treatment modalities. And it's easy to learn, so many therapists and counselors have been learning this method, and it's becoming quite accessible. So the methods for this study. Firstly, our participants, they'll be ISU students seeking counseling services for anxiety symptoms. They must meet the diagnostic criteria for generalized anxiety disorder, according to the DSM-5. And they must have an ACEs score, or Adverse Childhood Experience Questionnaire score, of 2 or more. So the measures we'll be using is once again ACEs. This is a 10-question questionnaire. Yes or no questions on different types of adverse childhood experiences. Each question that is responded to with a yes counts as 1 point, with a possible total of 10 points. The higher the score indicates more exposure to trauma. The GAD-7 questionnaire is a 7-item questionnaire using a Likert scale ranging from 0 to 3, measuring the severity that an individual of anxiety symptoms an individual is experiencing. A possible total of 21, with higher scores indicating more severe symptoms. So procedures in this study is in the initial intake, individuals seeking counseling services for their anxiety symptoms will be interviewed and offered to participate in the study. If they will be offered research credit, research participation credit that can go towards several different classes, course credits. If they want to continue, they will be administered an ACEs questionnaire, self-report, and they will be interviewed. They'll have an intake interview in which it will be confirmed if they meet the diagnostic criteria for generalized anxiety disorder or not, and they'll be briefed on the intent and methods of the study. Once the study begins and participants have been accepted into the study, they'll randomly be assigned to one of two groups, either receiving ART treatments or CBT treatments. They'll undergo weekly treatments for 12 sessions. At the beginning of each session, they'll fill out a GAD-7 questionnaire to see how severe their anxiety symptoms are that week. Here over on the side, I've included a example of an ACEs score questionnaire. Some of those questions involving sexual abuse, physical abuse, mental illness in the home, incarcerated family members, things like that that can cause high stress, especially on adolescents, children. So for data analysis, once again, we'll be using the ACEs score that is administered at the initial intake of the experiment. Also be using the GAD-7 scores. And we'll use a two-tailed t-test to compare the reduction in anxiety symptoms from the GAD-7 scores between the two treatments. They'll also use a Pearson correlation to see if there is a correlation between the higher ACEs scores and higher, more severe anxiety symptoms. So what we hope to learn from the study is, firstly, the most effective treatment for treating anxiety symptoms in those who have experienced trauma. The results could possibly be an indication of causation by which of these treatments is more effective in reducing symptoms. If a trauma-specific treatment like ART is more effective, it could be an indication that the trauma may actually be the cause. If that is the case, then we can be treating the root cause of the issue by helping process the trauma. Will be affecting the anxiety symptoms, lowering them. It can also confirm correlation between adverse childhood experiences and development of anxiety disorders, as other studies have done. And it could also lay the groundwork for additional studies on possibly combining CBT and trauma-specific treatments in treating this population. And that is my presentation. Thank you.